Hello, Okemo Valley. This is Carol Lighthall. We're tuning in today. This is the Chamber Updates show. I have two guests from the Springfield Medical Care Systems. Josh Dufresne is acting CEO. Katrina, and Katrina's last name is Taylor, sorry about that, is the just promoted to Chief Medical Officer. Talk about trial by fire, right? Today's show is really all about the COVID and the impact on our region and your hospital systems. I thank you so much for taking time out today. Talk a little bit, if you would please, just about who Springfield Medical Care Systems is.
Sure.
How many facilities, whatever you want to share related to that.
Sure. So Springfield Medical Care Systems, as it stands right now, is an FQHC, so it's a federally qualified health center, and that is within Springfield Medical Care Systems, which I'll refer to as SMCS. I'll try not to use too many acronyms, but if I do, I'll try to define them. So if I forget, please remind me. So SMCS has a couple of companies or business lines in there. The FQHC is one. It also has a daycare for children that is in Springfield Medical Care Systems as well. And the Edgar May Recreation Health Facility is a building that we own through Springfield Medical Care Systems. And then as a subsidiary of Springfield Medical Care Systems is Springfield Hospital, and many of the services that Springfield Hospital have, such as the adult daycare program, is one example, but they have many specialists as well within the hospital system. That is our overarching system as a whole. The FQHC is really what I'm focusing on right now and what Katrina has purview as the Chief Medical Officer for our system. We have 5 primary care clinics, and the regions that we cover are mostly Vermont. So if you think about Windsor and Windham County, those are primarily where we cover. We do have a Charlestown location, and that's over in Sullivan County. We have 2 dental sites. Those dental sites are in Chester, Vermont, which was the Chester Family Medicine building that we converted to a dental program. And we've got some additional operatories we're getting ready to install there. We're just waiting for some funding. Hopefully that comes to us through donations and things, and we can do that. And then we have a Ludlow dental site. So those are our 2 dental offices right now. And we have a vision site that's also in North Springfield, Vermont, Lane Eye. And that does a lot of our outpatient vision testing and works strongly with our primary care. And the dental offices is all integrated and really nice handoffs between those. And one thing that people don't necessarily know everything about is the school system. We actually have 4 sites in the Springfield School District. And those sites are really to be able to obtain time with students as patients, to really take care of them as they otherwise may not make it to the clinic due to transportation needs or due to other social economic needs. So we're able to get to them in the clinic through into the school through a pediatrician or a dental hygienist or a licensed independent clinical social worker.
That's great. I didn't realize that.
Yeah, not many people do. We don't really advertise it. It's one of those things where we wanted to help the school, and the schools as well as healthcare are starting to branch into a greater responsibility than what they initially set out to do hundreds of years ago. I think now it's much, much more than just teaching you something. You're focusing on, do you have food? Do you have the clothing?
Yeah,
right.
Yeah.
And healthcare is kind of hand in glove with that as well. So that's our system as a whole, the way it's set up.
Great, that's awesome. And so can we switch gears and talk about COVID and what it's looking like in our region? Is testing going on? Are there people being treated currently? What does that look like currently?
So currently, we do have testing going on. So we have a kind of drive-up testing site by appointment. We have changed a lot of how we've changed everything in terms of how we're providing care to protect both our staff and to protect our patients. And so a lot of our clinic time now is providing clinic visits via telemedicine or telephone medicine. We've started a bank of nurses that are triaging calls that are respiratory related, and then those calls are either getting pushed back to the primary care provider and or somebody who's kind of set up to take those specific calls for the day. And so from some of those calls are generated the orders for COVID testing. We also have a respiratory clinic as one of our walk-in clinics, so it's just focused on the respiratory cases, and that's an attempt to keep the higher risk cases from the other walk-in sites, again, to protect both patients and but also to be there for the patients who really need to be seen, because there are some patients who still really need that physical exam and that physical evaluation. So that clinic is also generating some of the tests for COVID. Up until last week, we were very limited in who we could test, and that was really coming down from the state because the ability to run the lab tests was such that we really had to focus on the highest risk. So just patients who were inpatient, sick enough to be an inpatient, and medical providers, so that we could rule people out and or in and get them safely back to work if appropriate when they were feeling better, as opposed to having to wait the whole 2-week period. So that luckily is starting to change, and now we're able to test more people with symptoms that are consistent with COVID, so fever, with cough or shortness of breath. And hopefully now that we can test more people, we'll have a little bit of a better sense of how prevalent it really is in the community. I think to date, within our community, we've had 5 positive tests. But
So
I think we're around 20.
And it sounds like, excuse me, tell me again what the 20 means. You just referred to a 20.
I think, and I didn't see the data for today. I know as of 2 days ago, we had 18 cases in Windsor County.
Oh, okay.
And I think that may be up by a few cases as of today.
And so for the 18, are people weathering the condition okay? So we've heard a fair amount. It's all over the media, as you know. And so when some people contract COVID and have relatively mild symptoms, is it fair to say that folks in Windsor County, the folks who've contracted it are also, or is it kind of all over?
I think there have been a few serious cases from people who've been diagnosed in Windsor County that have escalated to higher levels of care. Overall, the statistics that we know from China, about 80% of the cases do tend to be mild. And unfortunately, because we've probably had a lot more of the mild cases, but because we haven't had the access to testing, we don't have the numbers yet to support that.
Yes.
So once we have more of that data, which I think we'll be seeing in the next week or 2 weeks, we'll have a better sense of mild versus severe within the community.
And so what would you, I'm checking my notes a little bit, would you say people are generally following kind of standard precautions for this? Social distancing, washing hands, staying distance apart, any of that? Are you seeing that in action, or what would you like people to know?
Well, I think those are the most important things that people can be doing right now. And I think over the last week to 2 weeks, so we've seen a real shift in acceptance of that. I think people are now getting the message. I think at the beginning it was a little less clear, but I applaud how well people in the community are doing and how seriously people are taking this, because it's very important to take it seriously. But I know how difficult it is and what an impact it's having on so many people's lives, both socially and financially. It's and for those of us who are parents, who are now all of a sudden homeschooling, it's a big, huge shift as well. So lots of added responsibility. So even though the schools, I will say, have been doing a marvelous job, but it is a really challenging time. But I do feel people are finally starting to get the message, and that's the thing that we've been saying from the beginning, and why we shifted to how we were practicing medicine and caring for people so early on, in converting a lot of our patients to appointments to virtual appointments, because we really wanted people to know that the most important thing is to stay home and if at all possible.
In preparing for today, I was just reviewing materials about steps you were taking and so on, and it seems like the little hospital that could is doing an amazing job at taking the steps that you can take. The triage by nurses and doctors, the respiratory clinic is just amazing. Are you able to segregate? Have you gotten to where you have to think about segregating those patients that have symptoms? How do you do that?
So there's a number of checks and balances. So
yeah.
At all of the clinics, we have somebody at the door that asks people about their symptoms. And then, so there's that screening process right away. We try to funnel anybody with respiratory symptoms that would be concerning for COVID that need to be seen to the respiratory clinic. There are times we may ask somebody to go back to the parking lot and call from their car and have that discussion with a provider so that we can best direct where they need to go. Sometimes that may be that they can have that discussion and we feel safe saying, you can go home, you should make sure you're staying at home away from other people, taking good care of yourself, and that's the advice that can come right off the bat, and they don't actually need to enter any of the clinics. Other times we may feel they need to go to the respiratory clinic and they're directed there. If somebody is extremely short of breath, struggling with their breathing, then we may direct them directly to the emergency department. So we're trying to streamline that as much as possible. And we appreciate everybody's patience as we put these systems into place so quickly.
Yes.
And I think now we're kind of getting into the flow of it. The first week, there were definitely a lot of hiccups. People were getting triaged like 3 times in a row. But I think we've worked a lot of those kinks out. And I think, those were all done in efforts to keep everybody as safe as possible. So yes, we pretty much have separated the highest risk patients for COVID from the rest of the population in terms of where they're entering this system and or having those conversations at home.
And so you probably have to deal with a fair amount of anxiety about people imagining or thinking, is this COVID, like I'm have in the spring, I typically have sinus stuff going on, and but I'm just thinking about the general public going, is this COVID, what's normal? So the ability to talk to somebody, and they can still do that through phone calling, correct?
Yes.
Yeah, so that's really good to hear. Altogether, I think COVID reminds us all of how much we need our community health centers and hospitals. And so Springfield Hospital has had a challenge and has been in the process of reorganizing. And so what does COVID-19 mean to that process? Where are you with that?
That's a good question, Carol. It's in a way, and it's going to seem a little bit bizarre how I say this, but over the past year, our system has gone through enormous changes. And a lot of those changes have been behind the scenes. And a lot of it has been on our staff that are making those changes and really becoming as efficient as possible, reducing costs and doing everything they can to make sure that patient access doesn't suffer for it. And in fact, actually improves. So for us to really start to balance that and go through all of those changes, it's not really unlike what we're doing for COVID-19 preparation. We have a staff that has been extremely adaptable. They've moved to different locations. We have reorganized our entire business structure in 2 of our offices. So Lay and I in North Springfield, as well as Chester Dental, we've taken those staff and we've redistributed those staff to places that we see more surge or more demand. And those well visits or those people that maybe if we're just coming in for a routine visit, we've put those visits on hold for in-person visits to allow for us to really concentrate on those people that are coming in with those significant respiratory issues and funneling them to one location. At the same time, we had a conversation. We have over 40 clinicians in our system, and we had conversations with them about telemedicine. And telemedicine is something that we've done a little bit of, and the reimbursement model didn't really work. So there's a lot of reasons that systems didn't partake in telemedicine. We wanted to, but we just weren't necessarily allowed to do it the way that we wanted to. And a lot of those restrictions have been removed from state and the federal government. So they've allowed us to do that. So, by canceling somebody that's over 60 years old and saying, don't come in because we're afraid you might become infected with COVID-19 if it's in the area, and we're trying to save you from that hardship, and then not following up, that's just not something that we would do. We want to make sure we follow up with those clinicians. We follow up with those patients, and we say, hey, we have a telemedicine capability. Could you do a FaceTime telemedicine type of visit with us? And that's really helping. And that touches base on your anxiety question, because there's a lot of anxiety out there. There's, people that are sneezing right now and they're like, oh no, and, there's people I've seen with better PPE than we had initially at the grocery store, right? And so they're shopping at the grocery store completely decked out. It almost looks like they're at a rain game at Fenway. They've got everything covered. So we've seen that. From the financial standpoint of what I just mentioned, the canceling of all of those visits, right? That means that all of that revenue goes away and you're not going to capture it. The telemedicine has allowed us to capture some of it, but the reality is not much. So if you look at where we have been and where Springfield Medical Care Systems has been, and right now I'm just focusing on the FQHC, we've realigned a lot of things over the past year to be better suited for financial sustainability for years to come. And we started really in the hole at the beginning of this year. And when I say this year, that's October. That's the beginning of our fiscal year. And so we knew we were going to be starting low, but that's because we knew we had specific things that were happening and we prepared for it, like providers going on vacation and things like that. And so what we were able to do is we were able to forecast that towards the middle of the year and the end of the year, we were projecting about a $30,000 loss, which is doable. We can make up that loss somewhere along the year, right? So what we had seen is we had a loss through October through December. And we knew that was going to happen. What we didn't expect and what we were pleasantly surprised for is all of these changes that we were making started to pay off. We actually had a profit in January, and then we had a profit in February. And so those, I'm like, it's amazing. Black on a spreadsheet. That's what I like to see. And so you start taking those profits and you start offsetting that loss you initially had. Now, did we make up enough profit to offset that loss completely? No, but we were on the right track and we were doing well to get there. So enter COVID-19. And so all of a sudden, all the rules don't apply. And we need to do everything we can to be sustainable for our communities in all of the regions on a shoestring situation. And so we've been very blessed that HRSA, which is the Health Services and Resources Administration, which is the governing body of the FQHC, has provided us with some funding. And it's not a huge amount of funding, but it's some funding, and they're doing everything they possibly can. That was before the bill was passed federally. So they were able to come up with some funding for us. Now we have these federal bills that have been passed in order for emergency funding for FQHCs, emergency funding for hospitals. And so we're able to then apply and draw some of that down. We don't know how that's all going to work yet. And we know that because of our delicate cash situation, we have a relatively shorter fuse than a lot of other companies out there.
Mm-hmm.
And so we're working hard right now with the federal government, with our project officer from HRSA, and also with the state government. So the state understands too that there may be a difficulty for the federal funds to come down soon enough. And so they're working with us to see if they can help us through that process in trading of federal funds when they eventually come. And this is all just dialogue and discussion at this point, but the likelihood of this happening is pretty good. And, you know, I can't say enough at how helpful the state of Vermont has been through this entire process. They've really helped Springfield Hospital and Springfield Medical Care Systems weather this storm, and the federal government has as well. But what I've really seen help us weather this storm is the patients and the communities. You know, through the COVID-19 experience that we're going through right now, there's signs on the hills of Springfield Hospital that say, you know, we love you, thank you for what you're doing, behind you. And I don't know, I won't speak for anybody else, but I can tell you what, I could be having the hardest day ever, and when I drive up that hill, it's just energy. It's just pure energy, you know. So that it rewards me, and I'm sure others, for everything they do every day, and especially those on the front line right now. And we do, like never before, have costs in FTEs, which is full-time equivalents. We have individuals, as I said, from vision, and individuals from dental they're standing in the clinics, and they're helping us in the clinics, in a medical clinic, and they're not used to that. So
the patient that you were talking about in PPE, tell me about that.
So I walked into Rockingham Health Center, and there was a nurse, and she's sitting in the waiting room. And the coolest thing is she is donned in protective equipment, and she's asking these questions, something we hadn't trained for. I mean, we've had disaster planning before, but every disaster that we plan for, you know, there's so many potentials, and this COVID-19 is one that we didn't necessarily know exactly what questions we were going to be asking and whatnot. So people have scripts, they're asking those questions of the patients that come in, and the smile on her face just says it all. Like, I'm here for you, I'm here for the community. And that to me is just what I've seen across the board of employees embracing this and taking it in stride, knowing that this is extremely difficult. It just doesn't happen. It doesn't stop when you get home either. You know, your family's thinking about it. They're worried about you. They know you're in the clinic. You're in the front line. And so this is a lot of stress on top of a currently stressed system. So we've seen this amazing groundswell, which has been phenomenal. As far as the bankruptcy component goes too, I want to make sure that I answer all that question. We've seen the court be helpful to us in this process. We've had our financials, we review our financials with the court in 13 weeks increments. And so they know where we are, and they are understanding where we are. They also know the funding potentials that are out there. I think that there's going to be all hands on deck. So I've seen teamwork really come together, not only with the court, the legal system, the state, and the feds, all lining up to make sure that we're able to be where we need to be. So it's definitely getting on to more of a national and a global side of it. It's definitely testing our system as a whole, and it's helping us improve and be better prepared for in the future, which is fantastic.
So Springfield Medical Care System it has lots of company nationally, right? So community health systems that are struggling to get along, and how important they are. I mean, COVID is pretty dramatic, and it sounds like you were able to put systems in place in a very short amount of time while you're dealing with reorganization, and it's tremendous that you're getting the support from people in the state and federally to have that happen. You've talked about being on the front lines, and I think we all have to be extra thankful and appreciative of people like you that make sure, even on a day-to-day basis, you know, we're not feeling well, we have a broken bone, something like that, or when it is dramatic, like we're facing now, to have the resources down the road a bit, as opposed to getting in the car and driving for an hour, whatever it is. So thank you so much. Have we covered everything at this point, would you say, or are there some pieces that I didn't ask about? Anything else?
I feel like we've done pretty well. I will tell you one story that I came across last night, and this is for everybody watching. They can think about the COVID-19, the potential of it. As Katrina mentioned, it's a dangerous thing, and it can be fatal. There's no doubt, and especially if you have underlying health conditions, and if you're over specific ages, that's when it's most detrimental to somebody. So the travel ban, the shelter in place, when initially this was coming out, there was definitely perhaps an underreaction, I think, by the nation, right, and by the world. And so now I've seen us react in a way where I think we're reacting on time and on par with the actual way that this virus is spreading. But I do want to share some good news. I had a conversation with one of my friends, and she has some family in Italy, and her mother was diagnosed with COVID-19 4 days ago. And she's 45 years old, no underlying conditions. And she has made a complete recovery. So it's there.
Wow.
I want people to hear that too, because we hear about the death toll, and that's what it's measured, but you don't necessarily see all these people that do recover, and it is a recoverable piece. And there's a lot of, as we mentioned, anxiety around this. So yes, wash your hands, take care of yourself, stay home, follow the law, follow what people are asking you to do, because we got to protect those people that are in the higher potential of having catastrophic event from COVID-19. But I do want people to hear that there are people recovering from this with very minimum symptoms.
And how important would that, because we do see those death numbers a lot. And so I think there's a natural tendency to focus on that. But maybe beside that would be the recovered cases. Boy, that would be good to hear as well, I think, to keep things balanced.
Yeah, if we get I'm looking at Katrina too, if we get an unlimited amount of testing supplies and everybody is following that, that would be an easier number to come up with.
Yes. Well, you know what? It sounds like we're in good hands. I'm sure it's a challenge. I appreciate the two of you being here and everything you're doing, as well as everyone at Springfield Medical Care Systems. We're lucky, really, really fortunate to have you in our neighborhood. So thank you.
Well, thank you.
Thank you so much. Thank you for giving us the opportunity to speak. And thank you to everybody in the public that is really following these. And we really, really appreciate that.
We're on your team.
Thanks.
For sure.
Thank you.
Thank you.